Hi, this is Greg Kesich. I'm the editorial page editor at the Portland Press Herald, and I'm here today with Joe Lawlor, our Health and Human Services reporter, to help make some sense out of everything that's going on around Medicaid and MaineCare, both at the state level and at the national level. And Joe has been following this for 3 years at the paper, and he's been following it closely and is one of the experts in the state on this subject. So we're really going to learn a lot.
I will try to explain.
Okay, so MaineCare, Medicare, Medicaid, these terms get thrown about. Sometimes they're conflicting, sometimes they're the same. There's overlap. Could you just sort of outline what those different names mean?
So Medicare is for those 65 and older, and it's basic health insurance, hospitalization. And what a lot of people don't realize is there's some costs to Medicare. Often those costs are picked up by people either purchasing insurance it's called gap insurance to help you fill in the costs for that Medicare doesn't cover. And then if you're low income, you could also be a dual enrollee where you could be enrolled in Medicaid and Medicare.
But Medicare is for everybody over the age of 65.
Yes. And Medicaid is for folks who are low income or disabled, or as I was explaining before, it can be for those 65 and older if those folks are low income.
Or disabled.
Yeah. Right. And then the other, and MaineCare is just the main name for Medicaid. Some states have it's essentially the same program, but some states have put a special name on it, and in Maine we call it MaineCare.
MaineCare, Medicaid is a federal program, but the state runs it?
Yeah, that's correct. So MaineCare is it's a federal program, but the states have a lot of leeway in how it's administered. They have some flexibility in what categories of people that would be covered by Medicaid, and it's funded with a blend of federal and state dollars.
And how does that work out? How do they split that cost?
Typically, the costs are split. It varies. It's a formula, and it varies by state. But in Maine, the formula breaks out to roughly 65% of the costs are borne by the federal government and 35% by Maine. If Maine were to expand Medicaid, MaineCare, that would be the federal government would pick up 90% of the cost, and Maine would pick up about 10%.
Okay, I want to get back to that later, but let's just paint me a picture of in Maine, who's on Medicaid, MaineCare, same program, two different names. Who are the people who are getting that benefit?
It's about 265,000 people, so about 20% of the state population. 3/4 of the 265,000 would be either children, folks who are disabled, or folks who are over age 65 and are really low income and are dual enrolled in Medicare and Medicaid. About 25% of the enrollees are parents, or adults who otherwise qualify.
So it's interesting. I don't think a lot of people realize that you can get Medicaid, MaineCare, if you have a child with a disability. So even if the rest of the family isn't in the program, the child with a disability could be covered.
Sure.
Yeah.
Yeah, or there may be situations where, the children qualify, but the parents don't. That's not that uncommon.
So it can be a real lifeline for like a middle-class family that has some extraordinary health problems.
Sure. Yep.
This program's gone through a lot of changes in the last few years. Can you just sort of walk us through some of those? What's happened in terms of eligibility for people on MaineCare?
I think the biggest thing to understand is that under the LePage administration, there has been a lot of tightening, reductions in eligibility. So some categories of parents and single adults who were receiving MaineCare Medicaid previously no longer qualify for it. Also, if the economy improves and people get employer-based health care, then they will just fall, they would no longer have Medicaid in that situation as well.
So that's if you get a job and you start earning more than the income eligibility, then you would lose your MaineCare.
Right, right. Now, what's happened since the Affordable Care Act was approved in Maine? There's a lot of exceptions, but in many situations, if you earn 100% of the federal poverty level or less, then you would qualify for MaineCare. Now, if you earn more than 100% of the federal poverty level, now since 2013, under the Affordable Care Act, you qualify for subsidized insurance. So even if you say you got a couple of part-time jobs and your income went above 100% of the federal poverty level, which is for a family of 3 would be about $20,000 or so per year, and say you picked up a couple of part-time jobs or became self-employed and did better, and you didn't have access to employer-based health insurance previously, you could buy on the individual market, but it was very expensive. Under the Affordable Care Act, they have subsidized insurance, and if you're making, say, 130, 150, 175% of the federal poverty level, the government picks up most of the cost of your premium. That's the part of the Affordable Care Act that's not Medicaid expansion.
Let's talk about Medicaid expansion, because that's been a hot issue here for, 6 years.
Sure. And I guess I wanted to make kind of a broader point, too, before we really get into that, and that is in healthcare, unlike, say, maybe other parts of government spending, there's a lot of cost shifting going around. So if you think about it, if you don't have access to a doctor and you get sick and you go to an urgent care center and you go to a hospital, and those places are obligated by law to cover the cost. So you may not get a bill for that, but that drives up the price of private insurance, and it is also a pressure point on other government insurance, or it can be. It causes the hospital to maybe price things differently for people who have private insurance. So there's a lot of cost shifting going on. And if you think about, say, if you contrasted that with, say, schools, the benefits are a little more intangible sometimes. So like school A has like a ton of activities and programs, and school B doesn't necessarily have that, but you're still getting an education. There's not as much of a tangible cost shift going on. Whereas in healthcare, it's more the money has to get paid for somehow. So I don't know if that made any sense.
Oh, sure.
Not,
no,
but.
It does. It does. And I think it brings up a really good point, is that with Medicaid, the federal government, not the provider, decides what a service gets compensated at. They create the reimbursement rates and say, heart surgery is worth this. And it's providers say that they have to make up the money that as resulting from this lower reimbursement rates on the other payers. The way they cover the nut is to charge private insurers
exactly
more.
Right.
And one of the deals of the Affordable Care Act was that hospitals got this lower reimbursement rate with the promise that the states would all expand Medicaid.
A lower reimbursement rate for Medicare,
but not Medicaid also. Okay, so at any rate, the trade-off was that they would get lower reimbursement rates, but there would be more people with insurance, so there would be less charity care.
Yes, that's exactly right.
And some states did expand Medicaid and some didn't.
Right. It did soften the blow in states where there was a high percentage of people who got Affordable Care Act insurance, because those people still went from being uninsured to having some insurance, and Maine had a fairly high uptake on that. So the idea is, overall, is the fewer uninsured people go to the emergency room or go to the hospital for whatever reason, the less charity care and debt that the hospitals take on, and that produces downward pressure on prices in the hospital.
Okay, so we have this massive federal and state program that covers millions of people nationally, tens of thousands of people here in Maine. It is a major source of income for healthcare providers. It reaches a variety of different kinds of very needy people, and it is on the table right now in Washington to really change it dramatically. What are they proposing?
Well, I think there's a lot going on in Washington, but I think the thing that's easiest to talk about is because there's actually a bill that was produced, was the House bill, the American Health Care Act, which was approved in the House by a very narrow margin and is now before the Senate. And that includes some pretty massive cutbacks to Medicaid and ends the Medicaid expansion. And then on top of that, there would be cutbacks. So states would be under a lot of pressure to further tighten eligibility and leave less people insured in order to make the budget. So
my understanding is that the mechanism that they would do is in the House bill, they would look at several categories. I think elderly, disabled, low-income adults, and cap the federal share at a specific dollar amount. If you have a big unemployment crisis and more people come on Medicaid, it would increase. But what it wouldn't do is if they came up with a new cure that was very expensive, the state would end up having to pay the extra cost. And over time, as healthcare costs rise, as we know, healthcare costs always rise, and they rise faster than inflation. The state's share would get relatively bigger and bigger if the federal cap is fixed.
I guess one could argue that the states have some leeway from the standpoint is that they could raise taxes to fill in these gaps. And so there doesn't necessarily have to be cutbacks to services. What would be cut back is the federal share, how much federal money is being put into each state. And like you were talking about, there's different formulas, there's different ways of doing that, but at the end of the day, what it is cuts in the amount of federal money going into Medicaid in each state. So like we were talking about, right now in Maine, it's about 65%, give or take, federal money. Maybe if this were to go into effect, maybe 10 years from now, it would be 55% instead of 65%. And then if the state wanted to continue the programs that they have now, the state would have to raise taxes or find the money in some respect to make up the difference.
Or cut the services.
Yeah. And many are predicting that because it's an expensive program, that states would end up cutting services instead of raising taxes.
Okay, and so there's also a big change proposed on the state level with the waiver request.
What the state has done is applied for a waiver, and what that simply means is, as I was saying, that there's a lot of flexibility in how you can administer and how generous you want your state Medicaid program to be. And one of the things that you can do is apply to the federal government and say, we'd like even more flexibility, and these are the kinds of things we want to do, and the federal government can say yay or nay. There's been a lot of signals giving off that they're, from the Trump administration, that they're willing to consider and would likely approve some of these waivers that maybe wouldn't have been approved under the Obama administration, different political philosophies. So now Maine wants to have premiums for people who earn 100% or less of the federal poverty limit. It would be a flat $14 per month. And they also want to have work requirements where you would have to work 20 hours a week or volunteer an hour a day, roughly. I want to point out there's many, many exceptions to this for both requirements, including if you have children under age 6, it doesn't apply to you. If you're disabled, if there's many exemptions that it wouldn't apply to. But what some health policy experts are saying is that some people will either choose not to or won't be able to pay the premium, so there would be fewer people who would have Medicaid. And depending upon your political point of view, you might say that's a great thing because it provides an incentive for people to work. And then on the other side of the ledger, the Democrats would say this is a horrible thing because if you have health insurance, that actually gives you a leg up to getting work because you have some protection there to stay healthy, and if you have a chronic condition, to be able to treat your chronic conditions. and not have to worry about paying out of pocket for them.
And if 3/4 of the people on Medicaid are elderly, disabled, and children, you're talking about a pretty limited pool of people who would really be...
Yeah, I mean, there were some estimates that it would be about 50,000 people who would be affected, but I think there's, out of the 265,000 people who have Medicaid, I think there's a lot of exceptions in this waiver, so I think it's really hard to tell how many people would be affected by it.
And we've gotten waivers before in Maine, but they were always to cover more people.
Yeah, I mean, and that's actually a good point. There's a debate among legal experts as to whether this would pass legal muster, because all previous waivers that have been granted were to expand coverage, expand categories of people covered under Medicaid. And so this would, one could argue, would do the opposite, would contract coverage. So some legal experts are saying this would run afoul of the law, and actually one of our state groups, advocacy groups, Maine Equal Justice Partners, has vowed to sue the federal government if the waiver is granted as is or close to how it is now.
Also out there is a referendum on Medicaid that will go before the voters in November.
Yes, just to confuse people.
Right. As we jerk to the left, we're going to jerk to the right at the same time.
There's so much going on. I mean, there's been many attempts to pass Medicaid expansion in Maine. LePage has vetoed it every time, and they've never had the votes to override the veto in the legislature. But in Maine, you can petition the voters directly. So in November, Mainers will vote on whether the state should expand Medicaid. And this could be going on while there's still a lot of uncertainty about whether the federal government will fund a Medicaid expansion or not. And so it'll be, the next few months there'll be a lot to look out for.
And, assuming that it passes, it would be left to be implemented by a governor who, A, doesn't think we should expand Medicaid, and B, doesn't really care when the voters approve something. Would he really implement a program that he's actually opposed to?
Greg, I actually think that might be a bit of a moot point, because I think by the time it would go into effect, LePage would already be out of office, because it takes a while. You can't just turn on a switch and have the expansion. It's some administrative work that has to be done, and so the November, it's only a year from the 2018 gubernatorial election. So I would say the most LePage could do would maybe just delay implementation by a few months at most.
Right. So I'm glad you brought up the gubernatorial election, because clearly this issue is going to stay with us in terms of being on the front of mind of a lot of people. What's your sense of where the parties are on Medicaid and Medicaid expansion?
The Democrats are all in favor of Medicaid expansion, and there's actually probably a good percentage of Democrats who would be in favor of single-payer systems. So there's really not much debate on the left. On the right, Mary Mayhew who just announced her run for governor. She's a former DHHS commissioner in Maine, and she implemented a lot of the cutbacks to Medicaid under the LePage administration, and she's definitely against Medicaid expansion. And Susan Collins, Senator Susan Collins, who is considering a run for the Republican nomination, she just came out in a qualified way in favor of Medicaid expansion, saying it's beneficial. She was careful not to say exactly what Maine should do, but she pointed out a lot of the benefits of Medicaid expansion in other states, especially ones that were approved for one of these modified Medicaid expansions, where some people who have a little bit higher income, who are not like destitute poor, but have a little bit higher income, are asked to pay small co-pays and premiums.
So that was a very interesting comment she made, because she, as you said, this has been before the legislature numerous times, I think 5 times, and she did not weigh in. And she's always been very careful to stay out of state issues.
I thought it was very notable that she even made the comments that she did. And Mary Mayhew attacked her immediately for it during her the same day that she announced for governor. So.
Right, and saying Mary Mayhew said that she was uninformed, that Collins was uninformed about this subject, which is kind of funny because Collins is really a national expert on this.
Well, she also headed up the Bureau of Insurance in Maine at one time, right? And she is working on, or she is introduced with Louisiana Senator Bill Cassidy, a compromise bill that is much more in the center. Whether that would have any chance of being passed is unknown at this point. But her bill hasn't been analyzed as much, I would say, as some of the other bills, because it hasn't gone as far down the tracks as, say, the American Health Care Act. But there are some who would argue that the Collins-Cassidy bill would actually insure more people than the ACA. I think that's a debatable point. But Collins has said this on numerous occasions as well, that she wants a system that has more people with insurance, not fewer people with insurance. And so there's a lot of ways you could do that, and one of the ways is Medicaid expansion.
Any final thoughts, Joe? Anything you feel like you didn't get to? I can't believe there's nothing you didn't.
There's a lot actually that I didn't get to, but this topic is almost like an endless topic that you could talk about for hours, and I don't think anybody wants to listen to hours, or at least not too many people. A very small percentage of people would want to listen to hours of Medicaid talk. But I guess I just want to leave with this. I mean, there's a lot of discussion about government programs, and it can get very wonky and policy driven and hard to understand. There's a lot of nuances and ifs, ands, and buts. But at the end of the day, this is a really important topic because it affects a lot of people. It affects way more people than just the 1 in 5 who have. I mean, right off the bat, that's a lot of people that it affects. 1 in 5 people in Maine have MaineCare, but it affects the entire healthcare system, which is 1/6 of our national economy. So these are super important topics, and we encourage our readers and listeners to pay attention and be informed.
Well, thanks, Joe. I think, a lot of people don't want to listen to 5 hours of you talking about it, but I think everybody's grateful that you spent the time learning about it. So thanks.
Okay, thanhank you.
So if you have any questions or comments, you can contact us at letters-to-the-editor@pressherald.com. That's letters with an S to the editor @pressherald.com.
This is a Press Herald podcast. You can hear past episodes at pressherald.com/podcasts. You can subscribe on iTunes, on Android devices, and stream on Stitcher. Thank you for listening.